So we have a case here. This is Mark. This is a follow-up from a workup that I'll do with his diagnostics, but I just wanted to go over the protocol, the communication with the lab, and what the lab sends us back for a full mouth workup with the Waxup, specifically being Arrowhead. So here are his, we had done some Invisalign, we created some spaces, we created a set of spaces for prosthetic reasons, so we're going to make these teeth a little bit wider. I'll go over the specific treatment plan and the rationale of why we did what we did, but essentially here I asked the lab to create a Waxup. So when you send the case to Arrowhead and you ask for a Waxup for a full mouth rehab, they're going to send you the following. One is the actual Waxup itself. You can tell them what kind of tooth shape you want. You can tell them what kind of occlusion you want. But they do a really good job, really, from the information that you send them. As we talk more about these cases, we'll understand more about how to set up the case with the vertical so that we give the lab the proper vertical dimension so that they can do the Waxup. This particular patient didn't need a vertical change. As you can see, he's pretty well opened with the Waxup here. It was more of an aesthetic need, as you can see with his starting point here. There's some buttons on the teeth from Invisalign, if you were wondering what those are. Those will obviously be prepped away at the prep appointment. But the first thing they'll do is they'll send the Waxup. From that, they will then take the initial models and they'll do a prep model. And I'll show why they do this here in a moment. This is essentially to give you some idea of what the prep should look like. We'll come back to that. Then they send a Waxup, an Essex suck down of a stone model that was duplicated from the Waxup. And on there is an Essex stent that has holes in it, as you can see here. And what you'll do when you prep the teeth is insert this on. This is in the patient's mouth. And then you measure whether or not you have enough reduction. And what this does, it allows you to send to the lab preps that will allow the lab to then make the teeth look like this. Obviously, if you didn't prep enough, they wouldn't be able to make the teeth look like this because there's not enough prosthetic space to achieve that end. So you really need to send the lab, in order to make the patient's teeth look like the Waxup, you really need to send back to the lab preps that look something like this. This is a prep guide, okay? So you insert this on and you basically just measure as you go around the teeth prepping, you just measure to make sure that you have enough reduction. So prep guide, and then they also send these beautiful Siltec putty matrices that are made from the Waxup that allow you to make the temporaries. Now, what's special about this, and there's a few tricks that they do to make this that make your life way easier when making temporaries for full arch cases. One is they do the following. They take the Waxup model and they score the cervical. I don't know if you can see that here. Yeah, you can see that there. So they take probably a number 1 or 2 round burr and they score it so that when they do the Siltec, they create the Siltec, there's kind of a pinch point here so that when you transfer the Siltec to the patient's mouth, that pinch point is going to take all of the excess bisacral material and it's going to push it to the north so that when you take the Siltec out, you have really clean temporaries on the teeth. It is a phenomenally beautiful step that will save you years on your life by not having to reduce that by taking off the temporary, trimming it extraorally. It really makes everything clean. You can also see they did the same on the lingual. Okay. So that's the first thing that they do to make our lives easier for the temporaries. The second thing, and this is a concept that you can use in your single unit cases, they always thicken out the cervical area with wax. And what that does, it increases the volume of space for the temporaries. Now the finals may or may not be thick in this area. That's not the point. The point is the Waxup is over thickened in this area so that when you put your Siltec putty on the preps inside the mouth and you pull it away, you have a thickness of bisacril in this area that's strong so that you don't have chipping and fracturing in this area. We all know that we've done preps on teeth where we didn't reduce the teeth enough, only to find that we had inadequate bisacril, say on the lingual of number 18. For whatever reason, we didn't prep enough there. We put our stent on and it's very thin in that area. We all know what happens. It's very hard to kind of come back from that. So the equivalent use for this idea in single tooth dentistry is to take lab composite, etch, bond, and add some flowable to the cervicals of your teeth soon to be prepped before you make your stent. If you do this, I promise you're going to be so happy, because it's much easier to trim back a temporary that has too much material than it is to add to a temporary that has inadequate material. So somewhat of an aside, but it's just good to know when they do the Waxups, there's things that they're doing. Arrowhead understands this process better than any lab I've ever worked with. There are others out there. I'm not saying that they're the only one, but they understand these concepts very well. And what it means for you in the end is a very, very streamlined process. I can't tell you how many hours I've spent on temporaries that just are not required for this kind of step here. So that's pretty much it. This is the Arrowhead workup for full mouth dentistry. I guess one last thing here is this is the interocclusal index. Essentially, when you make your temporary on the upper, this will then slide on. Let's see if I can get this to fit. I'm sorry, this is for the starting point. So this would actually go on here. Essentially, this is the interocclusal bite registration at the starting point. And I'm having trouble getting these to slide in. There we go. So it's always good to have a bite reference point from where you start. That's what this is here. All right, I hope this helps, and I will maybe follow up with this case once we're done. But this will be a very predictable case with a great outcome, giving the patient the aesthetics he was looking for. He also had severe entrapment, TMD issues. Just from the Invisalign alone, we've already changed his life. He actually contemplated not doing the prosthetic parts because he's so comfortable, but his wife encouraged him to move forward. So we'll see you on the other side. Thank you.